The 7th of November 2016, a big day for Montreal's Sainte-Justine Hospital. Ministers and dignitaries celebrate the opening of a brand new research center.
C'est donc pas uniquement des locaux, c'est aussi une nouvelle façon de faire, une nouvelle façon d'être.
The bright and modern building is in the west wing of the Children's Hospital. But in the East Wing, at the very same time, a crisis is unfolding. For 5 days, Health Canada's inspectors have been seizing files and searching computers at the Charles Bruno Pavilion, reserved for children fighting cancer. Health Canada has just received an anonymous complaint about DecGen, a clinical drug trial for children with terminal cancer. The reputation of one of Canada's top pediatric hospitals is in jeopardy. By the time the inspectors arrive, the study is already in trouble. One child dropped out because of side effects. 4 others died. And the last of the 6 children will die while investigators are working. Within weeks, Health Canada would conclude that the study should be suspended. Was Health Canada right to close the study?
Oh, yes.
Why?
Absolutely.
Jonathan Findlay is the head of the neuro-oncology department at the largest pediatric hospital in the United States.
There were too many violations, and they were absolutely appropriate in shutting it down. It would have been wrong if they hadn't.
It wasn't so long before that, hopes were running high for the study. In 2015, it was billed as the first of its kind in the world. For the first time, Sainte-Justine's oncology experts were to conceive and run their own clinical study, instead of one designed by a large pharmaceutical company. The DecGen study's goal was to look at the effects of combining decitabine, an existing chemotherapy drug, with genistein, a chemical compound derived from soy. A combination that had never been tested on children, but could give a sliver of hope to those with no other option, or so researchers said. My femme and Toine Nguyen are both pharmacists and parents of 3 children, Liam, Eliane, and Lena, diagnosed with brain cancer at the age of 9.
Tout s'est passé assez vite. Elle n'avait aucun symptôme jusqu'à, disons, environ 2 semaines avant que je l'ai amenée à l'hôpital. À l'hôpital, ils m'ont fait attendre. Puis après ça, après un scan, 1 heure après, le médecin a dit « il n'y a plus rien à faire, madame. C'est 3 à 6 mois, puis c'est des soins palliatifs. »
That's when Sainte-Justine told the family about the DecGen study. Lena would be the first patient to sign on. Deep down, Lena's parents knew their daughter would not beat the cancer. Still, they agreed to take part in the study.
Nous espérons un miracle. C'est pour ça que, je dis, de toute façon, on n'a plus rien à perdre.
The miracle did not materialize. Lena died of cancer 27 days after her first treatment.
Quand vous tombez avec votre fille dans le vide, puis là, vous espérez un remède, vous priez le ciel n'écoute pas, priez la terre n'écoute pas. Puis vous restez avec elle jusqu'à quand que ce qui devait arriver, est arrivé.
That was December 2nd, 2015. Lena's parents didn't hear another word about the DecGen study. Shockingly, it was only much later they learned the chemotherapy drug their daughter was given had actually expired. The doctor in charge knew it and still ordered the infusion of medicine to continue. We found proof in the medical records. Dr. Michel Duval runs the hospital's hematology-oncology department. He doesn't see the problem.
Il s'agissait de quelques minutes de dépassement de l'heure de fin de perfusion.
Okay. Donc après quelques minutes, c'est acceptable?
Oui, je pense que quelques minutes de différence sur 24 heures ne font pas de différence dans l'efficacité ou la toxicité.
Lena didn't suffer any harmful side effects from the expired medication. Her parents were devastated, but as pharmacists, they at least hoped the study would amount to something. Now, they're not so sure.
Si on veut avoir des bons résultats pour les études, puis on n'est même pas capable de respecter le protocole à ce moment-là, le résultat final des études, je pense qu'on peut mettre des points d'interrogation là-dessus.
They're absolutely right, because it calls into question the validity of any results, whether they be negative results or positive results.
As they dug deeper, Health Canada was discovering a disorganized and incomplete drug trial in a world where precision, care, and respect of scientific norms are valued above all.
You've got to follow every single little step by the book and keep track of everything because it's very complicated, and if you get anything wrong, it can put in jeopardy the entire study. Mm-hmm. You have detailed procedures. You're following a checklist like a pilot on a plane, and you don't go wrong. Because if you go wrong, the plane crashes.
The research center's own staff was worried about the disaster coming. 8 months before the inspection, they warned their bosses.
They're asking us to ignore protocol. Incidents that occurred during the DECGEN study that should be reported to Health Canada are not being reported. That raises the question of the hospital's responsibility.
It was a high-stakes experiment. The combination of decitabine and genistein had never been tested on children, although it was tried on mice and adults without significant results, according to our sources. It was on that tenuous basis that researchers submitted their protocol for the children's study to Health Canada. The protocol is like the Bible of a clinical study. How would you characterize this protocol?
Poorly written. Superficially written and superficially documented in terms of the background. They could have done a much better job.
Dr. Findlay deplores the lack of clear scientific reasoning in the protocol, but he does believe the drug combination was worth trying.
Yeah, I thought the rationale was quite sound for that, the idea of looking at the two drugs together. Seemed like a cute idea.
What is the goal of an experimental cancer trial? What researchers call a phase 1 study.
You're testing for toxicity. You're trying to find out, can we use this medication on a patient population, and how much medication can they take before it becomes too toxic? The goal is not to provide therapy.
Maybe it's not, but we never really know what doctors say when they're trying to enroll patients. Do they know what they're getting into? Are they feeling the pressure? This is how the DECGEN study was sold to Jennifer's family.
Jennifer, même si elle était inquiète, elle montrait qu'elle était encore positive, elle avait encore le courage, elle voulait sauver sa vie.
Oui, bien sûr.
Mais elle était nerveuse.
Nervous, likely because Jennifer knew what was to come. She'd already been through 5 rounds of chemotherapy and a bone marrow transplant to treat 2 different forms of leukemia. As they do with all important medical consultations, the family recorded the doctor's presentation. It's much easier than taking notes.
We are the only center using that protocol now.
It's Dr. Yvan Sanson, one of the researchers, who speaks to the family. He is supposed to present the study objectively. Remember, the primary goal is not to cure the patient. It is a phase 1 study, he says to the family, but he also says another word, a word everybody remembers.
It was the word remission.
Remission.
Yeah, remission. It was significant to hear that word.
The aim at giving those drugs would be to have a remission, and then they can do another bone marrow transplantation after that.
It was the next important step in our treatment. Get to remission, be able to do a transplant.
9 times. That's how many occasions the researcher says the word remission during the meeting.
If you are not into remission after the first cycle, we can give a second one or a third one. And as long as you need to be into remission, we can give up to 12 cycles of that treatment.
He mentions up to 12 rounds of chemo, even though the other patients could only endure 1 or 2. But Jennifer's family didn't know that. All they could think about was the possibility of remission. Her brother, Michael.
It actually meant everything, because if there wasn't any chance of remission, I wouldn't have not advised her to go that route. There were other treatments, trials out there, and we would have gone with those other options.
Bryn Williams-Jones looked over the full transcript of the discussion between the doctor and Jennifer's family. Why, he asks, would anyone keep bringing up the possibility of remission in an experimental trial?
You don't talk about that in a phase 1 cancer study with children who are dying. Because what you're doing there is you're holding out a possibility that is unrealizable. That's unfair.
If you were wondering how a truly informed consent interview should look like, according to Professor Williams-Jones, this is it.
We don't know if it helps, and even if it helps, we don't know if it's worth the side effects that you could potentially have from the Larabine. Nausea, tiredness, fever, decreased.
In this PBS cancer documentary, a researcher lists in detail all of the side effects the child involved in the trial could experience.
You can see the list is long.
The parents' hope slowly fades.
It was an excellent example of how to do recruitment. The family is crying. They're sitting there trying to decide should they participate. And the clinical team who is recruiting is giving all the information, and they're making it really clear that the chance of it succeeding is minimal.
This is probably the hardest decision along the way that you guys have to make.
When we come back, Jennifer makes her decision, and the hospital fights back.
Je pense que Santé Canada avait une compréhension incomplète de certains aspects de l'essai clinique.
May 2016, Montreal's leading children's hospital, Sainte-Justine, is enrolling young patients in a drug trial it's hoping will make news. 20-year-old Jennifer and her family have to make a gut-wrenching decision whether to take part in the study. That is why the researcher, Dr. Sanson, tells Jennifer to think about it for a few days. She is relieved.
We need to think about it.
But a few minutes later,
we could do it today. We made a reservation with the anesthesiologist, but we need to do a lumbar puncture and a bone marrow before we start the treatment. It can be done today.
Yeah, you already made the reservation. Yeah, you can, because she hasn't eaten since midnight.
You could take like 7-Up, jus de pomme.
Maybe it can be done this week, or you may wait until next week. It's not an emergency that.
I think I would rather wait.
You certainly don't line up the next step before the person has even consented.
the operating room.
Exactly. You just don't do that. You don't put people in a pressured environment where they feel like they have to decide quickly. That's unethical.
Dr. Sanson did mention that a cure was improbable. We wanted to ask him about the tape, but he refused to participate. Instead, the hospital offered up 4 people to answer our questions. So, was it fair to raise the possibility of remission with Jennifer?
Très certainement, moi j'avais vu les données de souris, et avec ces données-là, j'aurais très certainement, en discussion avec les patients, évoqué la possibilité d'une rémission, en disant qu'elle était faible, mais qu'elle n'était pas impossible.
Jennifer thought about it for 3 weeks, and finally, she said yes. On May 26, 2016, she got her first dose of the Citabine.
On pensait toujours qu'on va sortir du tunnel, que tout va aller bien. On l'avait fait déjà pendant plus de 6 ans.
S'il y a une chance, on va la prendre.
Exact.
But Jennifer was not okay. She would only receive 1 dose of the Citabine. She was quickly diagnosed with a rare fungal infection, possibly related to the drug. In her state, Jennifer had a serious chance of catching a deadly infection, 39% in fact, according to the study protocol, a number that no one in the family was aware of.
So, what did you feel when she basically died in a little bit more than a month?
It was shock. We were in shock. It was very sudden. It was very sudden.
Yeah.
We felt like lost.
Jennifer died on June 23, 2016, from her cancer and respiratory complications from the fungal infection. Jennifer left behind a legacy. She and her family spent years raising money to fight cancer. They believed in cancer research. They still do.
Il faut tenir en compte qu'il y a les humains, qu'on teste sur les humains.
Qu'est-ce qui est important, c'est que on ne veut pas être des cobayes, ou si on est des cobayes, qu'on le sache.
Parce qu'il fait des sauts.
3 months after Jennifer's death, 5-year-old Guillaume Darèche, suffering from leukemia, is about to become the 6th and last patient. Like each and every parent, Guillaume's mother and father signed the written consent form. It's supposed to list clearly the trial's risks and possible benefits.
So far, it's incredibly evasive language.
Leading cancer ethicist Jonathan Kimmelman evaluated the 15-page document for us. He finds it unbelievable the consent form refers to a possible decline in the disease. Instead, it should have said,
if you participate in the study, the prospects of cure or the prospects of extending your survival are very, very remote. However, by contributing, you may be helping to advance our understanding of your disease.
Nowhere is this written in the consent form. Guillaume's parents, Sylvie and Richard, signed it September 27, 2016.
C'était très faible.
Il était pas fort, les petites jambes, rien.
But on the day Guillaume was to start the trial, a big problem. Some of his enzyme levels are too high, higher than the protocol allows, but not enough to worry the doctor. So Guillaume is allowed to begin the trial. A mistake at the hands of the research team, says our expert.
It's in there as an on-study requirement, and you have to abide by that. If it says something in there, we're not allowed to deviate.
And what does that mean?
The patient should not have been allowed on the study.
Ethicist Jonathan Kimmelman sees another problem with the research team. In documents we've obtained, the researchers make claims about the patient's chance of survival.
The studies in Phase 1 can help the survival of participating patients in nearly 10% of cases.
I don't know where they got that number. I've never seen numbers like that. I don't even know how you could quantify that, because usually survival is not even measured in a way that's reliable in Phase 1 studies, so that's certainly not consistent with the numbers that I've seen.
From what you know, that is untrue.
I have no basis for thinking that's true.
Guillaume died of leukemia and of a terrible infection, as Jennifer did. The DECGEN study was suspended on the day of his death, 5 weeks after he'd been admitted. And there was more bad news for the hospital. In their report 2 months later, Health Canada came down hard on Sainte-Justine. 76 violations of the Food and Drugs Act, including 23 critical ones, violations that presented a danger to the trial's subjects or undue risk to their rights, their health, and their safety.
To have Health Canada intervene in a study and say there's this shopping list of problems is extremely damning. Even a couple of errors would be an alarm bell for a research team. But to have a long list like that, that's a huge problem in a team.
The list is very long. Serious adverse effects and a death not reported to Health Canada. Incomplete research files, staff that wasn't adequately trained, and on at least 3 occasions, expired medicine like Lena received. Violations that the hospital describes as administrative mistakes.
They don't seem to know what they're doing. These are not administrative errors. These are problems with the culture of the research team and that research group.
The same team that did not tell any of the parents about the suspension of the study.
Comment vous avez su que l'étude à laquelle a participé votre fille avait été suspendue par Santé Canada?
Mais au fond, on n'est pas au courant.
Vous n'avez jamais été informé de ça par Sainte-Justine?
Non.
In fact, we were the ones to tell them.
Est-ce que les parents n'auraient pas dû être mis au courant de ce qui s'est passé avec DECGEN?
C'est une question qu'on s'est posée. Comme notre interprétation des faits qu'on maintient toujours, C'est qu'on n'a pas mis en danger les enfants, qu'on n'a pas eu d'impact sur la survie. C'était pas nécessaire d'appeler les familles pour les tarabuster avec ça.
And something else was troubling. The hospital's ethics committee only learned of the study's problems on the day of the suspension. So who was watching over DECGen? Scientific oversight would normally be done by an external firm, but hiring one was too expensive for Sainte-Justine. Who then was monitoring the data? A hospital employee. That's unacceptable, according to Jonathan Findlay.
You need external monitoring. So the question should be asked whether an institution that does not have the experience and expertise at conducting a phase 1 trial should be in the business of doing phase 1 trials.
The researchers did not take the suspension very well. Sainte-Justine fought hard to get Health Canada to reverse the decision. For more than a year, the debate went back and forth.
Yeah, it seemed very strange. If this was an FDA-regulated, site visit, they wouldn't have taken any of those, back answers. They would have just, you're closed down.
Health Canada ultimately determined that the children died of their cancer and that side effects were in accordance with the protocol. But they should have been reported because of their frequency. And in the end, Health Canada stood by its decision to suspend the study. As for the scientists, they still believe that the DECGen combination merits a second clinical trial.
Je pense que Santé Canada avait une compréhension incomplète de certains aspects de l'essai clinique.
Mais allez-vous relancer DECGen?
Je pense que ce serait dommage de priver les enfants du Québec de ce genre de thérapie innovante.
Est-ce que j'aurais mis mon fils dans cette étude? Je pense pas. Parce que le niveau des risques mentionnés, le manque de clarté de la science, le manque de potentiel bénéfice quelconque et le risque que mon enfant devenait plus malade, à mon avis, ça c'est pire que de l'aider à décéder avec toute la dignité possible.
Donc, d'abord, ne pas nuire.
Exactement.